Hello and welcome to Technology Update. On today's show, we listen to some pretty cool tunes. Russia gets caught up in the next industrial revolution. Miracle materials make for medical marvels. And we hold our very own Mad Tea Party. But first, in today's fast-paced world, the race is on to get more done in less time. But the old saying, more haste, less speed, was never truer than on the roads of the world's megacities, where crippling congestion slows progress to a snail's pace. So perhaps a dose of high-tech decongestants will help cities breathe easier.
The surface coating should have the exact same composition as bone, so that the body doesn't reject the implant once it's inserted. So our task is to minimize the difference between the bone tissue and the implant. Ultra-thin calcium phosphate films do this perfectly.
Calcium and phosphate together make hydroxyapatite, which is a natural component of bone. The coating is applied by a process called physical vapor deposition, where calcium and phosphate are vaporized into a plasma, then condensed into a thin film onto the implant in this patented vacuum chamber. The whole procedure takes several hours, but the finely tuned ratios ensure the long-term success of the implant. The atoms gradually dissolve, stimulating bone growth around the implant, which results in a solid, natural bond.
As well as modifying bone implants, we have started researching ways to make ultra-thin coatings for coronary stents. As we all know, any malfunction of the cardiovascular system could be lethal. That is why searching for new ways to prolong the life of the patients is of utmost importance.
Stents are small mesh tubes that can be expanded to keep weak or narrow arteries open. Unfortunately, delicate arteries can be damaged during the implant operation or subsequent expansion. So, to avoid complications after the operation, the stents are coated in titanium nitride oxide, or TiNO for short. The super smooth coating helps avoid arterial damage and promotes healing, significantly reducing the risk of blood clots forming or the artery collapsing again later. The coating also remains intact as the mesh tube is expanded within the artery. Just like bone implants, the stent coatings are applied using the PVD process.
There is so-called early thrombosis and late thrombosis. The stents currently on the market guarantee successful treatment for older patients with early thrombosis. But there's increased risks of late thrombosis occurring even after several years. Our preliminary findings allow us to predict that we can avoid both early and late thrombosis.